Hi everyone, my name is Mishi Bahadur and I am currently a senior in the Department of Public Health at the University of North Carolina. And the place of my internship was in Winston-Salem, North Carolina at Novant Health Community Benefit Center. My first objective for that internship was to synthesize data collected by Novant Health and see what was the most common barrier slash gap that was preventing people to get to care. After I did that, my next objective was to collect primary data. To do this, I developed my own questions and I interviewed 9 different agencies in the county and city that were trying to reduce the barrier that were caused by social determinants of health. Once I was done with that step, before I go on to my next objective, I'm going to show you all. Here's the list of the questions that I developed for conducting my interviews. Some of the questions were like, from your experience, what are some of the challenges in the community you serve? What do you think are the biggest obstacles to healthcare? How can we make access to care better and such? After I did that, I put all the data that was through primary and secondary together and made a PowerPoint presentation, presented that information to my preceptor and her team. I also developed a resource list or guide kind of thing. This has all the resources that are available in Winston-Salem and Forsyth County that includes behavioral health resources, clinical resources, child resources, dental resources, and stuff like that. This was a great way to put all the information that I collected together because my preceptor wanted a copy of that and she actually kept it and she wants to use it eventually someday when she needs to. Okay. So after that presentation, I was told by my preceptor that I need to come up with the best recommendation to deal with this issue that I found during my data collection was the most common. I just want to say one thing. Assumptions can be bad. I actually learned that myself. My assumption was before I began that internship that a lot of people won't have the insurance to get to care, and people such as low income would be having a hard time not being able to afford. This was not the case. During my data collection that I learned transportation was a major barrier for the patient to get to care. There were a lot of free resources or reduced in resources that you could go to. Many different clinics were offering free screenings, free many other things, but the main problem for the patient was to get to access to care, and this was because of they were not able to find a transportation to go to the places that were offering those resources. Some of the lessons that I learned during this internship were that everything doesn't go by the book. You cannot just develop one big plan and hope everything will work just the way you want it to be. You have to modify a lot of things during this process. I learned that I really wanted to interview the actual patients and see what their perspective was about the major barrier and gap, but I wasn't able to do that because because of the privacy and HIPAA laws, I wasn't able to access any information. I also learned that people love to hear about themselves. So if you want to be successful, you have to be nice to your team, your preceptor, and everybody. For the future intern, I would recommend that get in touch with the preceptor before you even plan to do that and develop a really good relationship with her. She is an awesome resource and can help you a lot. Thank you so much everyone for listening to my presentation, and I hope you all have a wonderful semester.